Let's start with a quick question. Can you please introduce yourself briefly?
Yes, my name is Karina Marin. I'm 24 years old. I am living in Germany, but originally I'm from Romania.
So, why did you decide to come abroad for your surgery?
That's very easy to answer because I just wanted a change in my life. I wanted to look good, to feel health, and to be happy with me looking into the mirror.
That's very reasonable. What made you choose Erdem Hospital?
That's a very beautiful story. Like I said, I am Romanian, and I think everybody knows that Romanian women are very much into this great beauty industry. Yes, I'm in Germany, but I follow on my social media platforms. I follow a lot of Romanian content creators, and I saw a few popular influencers that made a partnership with Erdem Hospital, and they made very good advertising content about it. I think the most important thing that I saw on these people are the results. They also made surgeries in this hospital in Erdem. The results were fantastic, and they convinced me to come to you.
That's great. Before surgery, what challenges were you facing with your health and weight?
That's a very full of pain question, actually, if I may express myself like that, because it was very hard. It was very difficult because my whole life I gained around 60 kilos. Like I had a body that I loved, and life it's not always easy with old people. Now I am 24 years old, but at the age of 21 my career went down, my school, family, everything was a house. It was chaotic in my life, and the only thing that made me happy was eating. I ate a lot. I was happy only when I ate. Like I said, I was very depressing, anxious. So I ate a lot of junk food, sweets, but not the food was the problem, but the program. I didn't had a program. I didn't had a job. It was very difficult to find a job. And night, day, even on the street, I was eating. And I gained in 2 years, I gained 30 kilos. 30 kilos in 2 years. I had 95 kilos when I did the surgery. So I saw the people around me, and they were starting to ask questions, to look at me with different eyes, and the society was pressing myself. I didn't want to leave the house. I was always into the house, hiding myself. It was very difficult for me even to take my shoes on, because I was struggling but with my body. Yes, even wearing a pair of jeans was very difficult, and the people like me, they know the struggling to take a pair of jeans on. And yeah, these were my problems back then. Society, program I discovered back then. I do some checkings, like health checkings, and I discovered that I was this close to have diabetes because of the weight. I discovered that I have PCOC. That's some difficult problem to deal with, and yeah.
I hope all these challenges are gone away now.
Yes, they just evaporated.
Yeah,
Now
they just
it's
disappeared,
good.
right? Yeah.
They just disappeared. Yes.
Did you have any concerns about the surgery before coming here?
Yes. But I was scared. I was afraid because this was my first surgery, like ever. But I did a lot of reading. I informed myself. I was asking people around me because I knew a few people who have done this procedure. I informed me, and I was reading a lot. I saw a lot of videos like this, like we are making right now, and I took all the courage that I had in my heart, and I went to Turkey. Yes.
What do you think about the post-op support? You know, we've been in contact since surgery. How was it?
That's very funny because I told Alex, my husband, that I will be a problematic patient because I know myself. I am a bit dramatic. I told him I will be a problem for the nurses there in the hospital because I'm not dealing very well with pain. Back then, I worked myself in a hospital. I was a nurse. I know how people can be a little bit dramatic when it comes of pain, but I can say the nurses there and the whole staff into the hospital, they were fantastic because this kind of personality that showed me you are safe. You can have anything you want here as long we know that it will be for your good.
Yeah.
So the nurses were perfect. After the surgery, I had all the support. I had nutritionists that were each month they were asking me, how do you feel? What do you eat? How is your diet? How much do you weigh? And I didn't even had to write them. They were writing me, you know?
Yeah.
So yes, with the support after the surgery, after coming back in Germany, everything was perfect. I don't have what to say because everything was good.
I'm so glad that you're happy with our services. How would you describe your physical and emotional challenges?
I'm more active. That's what I observe. I'm more active. Like I go outside, I take more photos because I didn't want back then to take pictures of myself. I'm happy with the pictures and I found new job and I feel the society around me. It's not a good thing, but I feel that the society around me is accepting me more, you know?
Yeah.
They see me with other eyes. The society around me is more friendly and acceptable. It's not a good thing, I know, but that's the reality that we are living in.
Definitely. What is one nutrition habit that you are most proud of today after surgery?
The habit that I'm proud of. You know, after the surgery, you are still the same person, like when it comes to enjoy food. You can eat everything that you want. You can taste everything that you want. After a few months, you can you can still have the same taste in food after the surgery. So it's not a problem about this. I'm proud that I can say stop when I want. Because back then, when I saw food, I had all these cravings. I was struggling with, I don't know, I didn't have stop, you know?
Yeah.
I just ate and ate and ate without stopping. I want to say something very important for the people that are watching and who want to do this. Read about ghrelin. That's the hunger hormone after the surgery. The ghrelin levels, they are reducing considerable. You don't have these cravings anymore like before because this hunger hormone, it's not fighting like back there, you know.
Yeah.
And for the people, please read about ghrelin hormone and how it acts after the surgery because that's very important to understand.
Yeah, definitely. Before
So
surgery.
that's why I'm proud. I'm proud because I don't have all this hunger anymore, and I can say stop. I'm very neutral when it comes to food. I'm very proud of.
Yeah, before surgery, your hunger hormones were secreting more, but now
Yes.
our surgeons removed it.
Yes.
Not all surgeons remove this hormone,
I know.
so it's
I
really
know.
important to choose the right surgeon about this. Our last question. What would you say to someone who is considering bariatric surgery but feels hesitant?
Just do it. Just do it. Yes, it's hard. Yes, it could be painful. I had pains. Let's be honest. If you don't respect what the doctor says, like for me, Dr. Adnan was my doctor. If you don't respect what the doctor says, it could be painful. But yes, this involves changes and this involves a lot of difficulties after the surgery, like not eating like how you were used to. You're not cooking anymore like you did back then. You will lose hair. You will lose hair after the surgery because our body needs to react somehow at the surgery. And it was a shock for my body because indeed I lost a lot of weight in a very short time, like 8 months. You will have loose skin, yes. You can have loose skin, but we are living in 2026, so there are a lot of changing that you can do. Like you can take collagen, you can make everything to look good. So yes, it involves a lot of difficulties, but if you respect what the doctor says and what the nutritionist says, you don't have to hesitate.
Definitely.
Yes, me personally, after the surgery, I took some vitamins, some supplies for my body because, of course, there's a very big change. So the body is having a shock. But with vitamins, collagen, supplies, you can definitely pass through this. So do
Definitely.
it.
And also, we have another option for the patients whose skin is sagging. We have nice plastic surgeons, so they can definitely come to us if they have a major problem, of course. Thanks for joining this call with us. It was a pleasure for me to meet you. Thanks for your answers.
I want to apologize myself because my English is not perfect for the, I don't know, maybe I did some grammatical mistakes, but I spoke with all my heart and I spoke full of interest because I want to say this to the people who are watching. Don't think about this twice because your body will thank you later. This can be the change of your whole life. So, yes, you can be hesitant, but think about you feeling good because I feel good now. I'm very happy with the results. I hope that everybody who is making this choice will be happy after because I saw a lot of results and I saw a lot of experiences. They wasn't very good, but me personal, I had the best choice with RDM, Dr. Adnan. But what can I say?
Yeah.
Just think about it.
This surgery is great, but what's more important is to choose the right hospital and the right
Yes.
surgeon, definitely.
Yes, yes, because the hospital was very clean,
Yeah.
the staff was very good,
Yeah.
and that's what's important because you can do it all around the world.
Definitely.
You can do it all around the world, but not every hospital has these modern machines, you know. Not every hospital is very hygienic, you
Yeah.
know what I mean? So, yes, think about it twice when you want to do this choice.
Yeah, definitely. Thank you so much. So, do you have any other things to say, or can we turn off the call?
That's the most important thing. Thank you to the Dr. Adnan,
Yeah.
RDM Hospital nurses. Thank you because you are very nice and friendly. Thank God everything is okay now.
I'm glad you're thinking this way. Okay, then, have a nice day.
You too. Thank you
Bye.
very much.
Bye.
Bye.